Sanbanani Babugeli Emakaya, welcome to you all on uhlelo lwethu osilithanda kakhulu holistic healthy living. Lapho sifundisana ngezempilo. Siyabonga ukuthi nihlanganyele nathi ngalesi sikhathi. Would also like to thank our bishop as well as the lady bishop for giving us this opportunity, giving us this platform to reach you Emakaya and teach you more about your health, because you know we remind each other that your health is your responsibility. Guyo inyanga yabafazi yezimbogodo, and yes, that is the month of August. Kanti saqala sakhuluma ngayo cervical cancer, begumnandi safunda. Namhlanje we bring to you yet another very important topic, infertility, and this is ongena futhi naku contraception. Today we have once again a powerhouse. Niyazi ukuthi we bring you only the best. We have Dr. Mahlaromela Emmanuel Moahi, completed his MBCHB degree, that is medicine degree, in 2006 at Medunsa. He then went on to work as an intern. He did his community service and worked as a medical officer until 2011, both in Limpopo hospitals. And he then had the interest again in gynecology, where he started, which started during community service. He then worked as a medical officer in Polokwane, Mankweng Hospital Complex for 19 months, where he obtained his diploma in obstetrics through the College of Medicine of South Africa. He then did his registrarship at Steve Biko Academic Hospital and the University of Pretoria and qualified as an obstetrician and gynecologist in May 2015. He worked briefly in Netcare Montana Private Hospital and then moved to work at Tembisa Provincial Hospital. Currently, he holds a fellow in the reproductive medicine, including infertility and advanced endoscopic surgery at Steve Biko Hospital since 2019. He is also practicing in Landmed Zamoguhle Private Hospital as a obstetrician and gynecologist, including advanced endoscopic surgery. Dogotela, we welcome you.
Thanks, Zindle, and greeting to the viewers.
We are grateful for you to come through today. You know, the trend we've been seeing Women's Month, and we've been actually having male doctors. Doc, your profession.
Yes.
Why did you become a doctor?
My story is kind of interesting. When I was in primary, my grandfather, whom I was named after, I think I was in, we used to call standard 4, he's grade 6 now. He said to me one day, he said, grandson, one day you are going to be a doctor. He was a traditional healer. So he said, my father died when I was still young, so I had no one to take me to school, but you are, I became a traditional doctor, you're going to become a Western doctor. I didn't believe him. As the years went by, when I got to matric, I realized, no, this is not my thing. Looking in TV, looking at blood, I said, no, I'm not going to do this thing. And then I applied for engineering. Everything was approved, had a bursary. All they just waited for just my results, which I was, when the results came out, I was qualifying for the bursary and the engineering. But my family gathered, they said, no, you are not going there. You are going to do medicine. They ganged up against me, cousins, everyone. They said, they begged me, they literally begged me to go and do medicine. They said, we want a doctor in the family. Then I eventually succumbed. I remember that January, that night I said yes. And they said the following day, they say, we are leaving. That's how we end up applying for medicine, and I got in.
And you are here now.
I'm here today, yes.
Wow, Doc, and you are a specialist.
I am.
In infertility.
Yes.
Why infertility? Why did you go to that route particularly? In fact, before we get there, why obs and gynae?
You know, the love of obs and gynae, when I started my internship. When I left medical school, I didn't want to be a specialist at all. I was said normal books. But when I went into the field, when I started practicing as an intern, community service, the love actually started towards the end of the internship, where actually to me it looked very interesting to be helping families, seeing women smile after delivering their babies. Then when I went to community service, the hospital I went to, it was a district hospital where there were senior guys. They didn't want to work in the maternity unit because to them it was maternity was very busy and they would leave late. So they said no, none of them wanted to go. Look at that, I like challenge. I like challenge. I said, this looks like why this guy's scared. Then I went and took over. I said, I volunteered to work in maternity. Then that's where the love then grew even bigger.
Oh, okay.
That's when I ended up deciding I said, now that let me challenge myself, let me go and work in a tertiary hospital, same unit, see if I can cope. Then looking at that everything was going well, then I ended up writing my diploma. That's how then I loved it. And my mentor at that time, who was the specialist, encouraged me to apply to go back and specialize. Then I ended up doing that, and I'm here today.
Wow. Siyabonga kakhulu babukeli emakhaya niyazizwela udokotela is very passionate about what he does. Kanti ke sishilo sathi today we will be talking about infertility. Now doc, what is infertility?
Infertility is when a couple, if a couple, a healthy couple, that had been trying to conceive, to fall pregnant, we give them a period of 12 months. With a period of 12 months with regular intercourse. Regular intercourse with at least we recommend a minimum of 3 days a week.
Okay.
That we call it a regular.
All
Trying
right.
over 12 months without using any contraception. If there's no baby, then we said there's a problem, then we need to investigate, there's infertility here.
Okay, so doc, it has to be after this 12 months.
Yeah, we give it 12 months, but we subsequently modified it depending on the age. Those that are above the age of 35, because we think we don't have enough time to wait, so we give them 6 months.
Okay.
If in 6 months you are above the age of 35, we've been trying regularly, and there's no baby, then we said we need to check there must be a problem, we need to check.
Okay.
Yes.
Now doc, what causes infertility?
There are many causes.
Yeah.
It can be from the male side,
Yes.
it can be from the female side.
All right, male side doc.
Yes.
Okay.
Males, actually, you know, in our culture, in African culture, we believe that when there's a problem, when there's no baby, the woman's the female is
like
the one with the problem.
we always say it's the female.
He said the woman must go and check. You've got the problem. It's not. Male can also the problem. Actually, the causes from depending on whether it's the female side or from the male side. From the female side, it can be the hormone side, which is the problem. It can be the brain, where it's from the brain. It could be the uterus itself. From the male side, also it could be from the sperm itself. If you find the sperm is inadequate, it could be we find the duct that are transporting the sperms are blocked, so the sperms are unable to get to the where they are supposed to be in the female reproductive tract. So it's different causes. Can either be infections that can cause that, both males and females, or could be just the hormones themselves.
Okay, so doc, if we really please to reiterate the fact that males can also be, the ones in the wrong. And as you mentioned, Dr. Vele Ngampela, in our culture, it's always the female.
Yes. Actually, interesting enough, is about 40 to 50%, half of the infertility of the infertile couple. 50% will be males and 50% will be females.
Hey.
If I were to break it down, if you had to share, in 100%, about 33% will be females. That comes with infertility. 33% will be males, and the other remaining part, they share 50-50, which is almost equivalent. So that means 50% males, 50% female. Both of them, they can have problems. Just that male, they don't check. Is that they don't check, like we said in African culture. A woman must go and say, you cannot conceive, you need to go and check. And males, they stay behind. Meanwhile, they're the ones with the problem. Can be either way.
Wow, Doc, you know, now that you've said that, sure, ababukeli amakhaya bayazibuza ukuthi okay manje sifaka le show lena ye infertility and siyenza nje in Women's Month, you know, as though it is really predominantly a woman problem, but yes, as much as it's in women, but male people, you know, males can also be a major contributing factor.
Yes.
That is interesting. Singapheli amandla, you know, siyazi ukuthi siyafunda ngaso sonke isikhathi and siyaqela futhi kakhulu ukuthi sifundeni, sizweni, silaleleni bese siyenza. Singagcini kuphela ngokuzwa. Singagcini like singabi, you know, kunzima sometimes ukuthi umuntu esekhulile esemdala esengaka uzomtshela ukuthi hayibo, no, it can also be ngale ndlela le, because usually, you know, once people bakhulile badala, like there's really nothing much that you can say to them, but siyacela nje siyacela kakhulu ukuthi let us take the teachings that we get here and sizamukele, singagcini ngaloko, and then we actually apply. Now, Doc, with infertility, asithi-ke nangu-ke, you know, a woman comes in and you guys find ukuthi they're infertile. What do you do for them?
So there are the few tests that we, when couple comes in, so when they come as a couple, then we need to check both of them.
All right.
With the female side, you need to do a couple of times, it can be a bit complex. So we need to check the hormones, like I've said that the hormones, if they'll guide you as to where the problem is. Could be the brain, could be the ovaries. So we check the hormones.
Okay.
So you need to check the tubes, if they are blocked or they are open. Because the sperm needs to get to the egg. So via the tubes, so we need to check the tubes are open. We need to check also within the uterus, if the uterus, the house is suitable, if there is suitable to carry the baby. So there's a test we called hysterosalpingogram. It's a straightforward an outpatient test. The patient just goes into the X-ray, we push the dye under, then it will tell us if in the cavity everything is clear, if the tubes are open. So that will be there from the X-ray side to check the tubes and that, and the ovaries. They are with the ovaries. We just need to check the hormones. Once that is clear, we said no. From the woman's side, we are happy. You are clear, and also ultrasound. Ultrasound just check as well if we can see, we're able to count how many follicles you have, so that in that way they will help us to estimate as to how long it will take you. Maybe take you longer to get eggs, or it be quicker.
Dokotela, sorry, abantu mhlambe bayazibuza follicles.
Oh, sorry, yes.
Sikhuluma ngani masikhuluma ukuthi niyochecka ukuthi unama follicles?
Yeah, I went too deep there. So with the follicles is what the eggs that comes out.
Okay.
So we just need to check if we're able to assist you, give you some drugs. How many eggs can we get out?
Okay.
So we just need to check if we are able to succeed. From the male side, test is simple. You just need to check the sperms.
You check the sperms?
We just check the sperms if the sperms are there, if they are enough. If they are there, they are enough. They are able to swim, because they need to be able to swim to get to the egg.
Okay.
If they are normal, because you need normal ones to be able to fertilize the egg. Simple test, just sperms, cheaper. Then it will give us all what you need to know.
Wow. So, Doc, can it happen, Uguti? Yes, you've got sperms. Let's say umuntu is just like, but now, yes, you know, I ejaculate. And I ejaculate fine. Could, like, if it's umuntu onjalo, could that still be, you know, umuntu abe infertile still, though they've got, like, enough sperm? Yeah,
the ability to ejaculate, it doesn't necessarily mean that what you're ejaculating. Remember, with the what we call the semen.
Okay.
So we call the semen. What a semen, it composed of the sperms. It composed of the seminal fluid, the fluid that comes from the prostate. So the prostate will give some fluid, and then what we call the semen. All those the combined, we call them the semen. They are there to protect the sperms. So even though you don't ejaculate the sperms, the prostatic fluid will still come
Okay.
out. So you still feel like I'm the man here,
Yay.
even though there's nothing
Country,
in the
there is
fluid.
nothing in
Yes.
there. Yo, country, there is nothing. Uthi dokotela, the ability to ejaculate akusho ukuthi lento oyikhiphayo. Right. Angithi docs. Now, doc, so umentionile ke ukuthi you would then go and you test both parties.
Yes.
And then what do you guys do thereafter?
So once we've established where the problem is,
Yes.
being the female side or from the male side. So from the female side, if something that we can fix is from the hormone side,
Okay.
if problem is with the brain or with the ovaries, if the problem is with the tubes, unfortunately with the tubes is very tricky to fix the tubes. If the problem is in the womb, in the uterus, we can fix the problem. So if the hormones are not correctable, so what we will use, there are options.
Okay.
We can either do what you call assisted reproductive techniques.
Okay.
With assisted, depending on where the problem is. If the problem is with just the sperm is able to go through the tube to the ovaries, but the ovaries, they are not able to release the egg, then we can do what you call intrauterine insemination, where we push the ovaries, we stimulate the ovary to prepare the egg, and then we get the sperm from the male, and we push the sperm under to go and get meet the egg in the tube. If the problem is with the transport, where if the female side, if the tube is blocked, unfortunately then because now it's blocked, the sperm can't get to the egg. That's where we call the in vitro fertilization comes in.
Okay.
So then we need to do it in vitro. Then we just mimic whatever that was supposed to happen in the tube, we do it in the lab this time.
Okay.
If the problem is from the male side, then from the male side, we don't have luxury of a problem. If the problem with the hormones, sometimes you can fix them.
Okay.
If otherwise, we'll do also assisted reproductive. In this case, if there are the sperms are too few, because you need a certain number of sperms to be able to swim. Swimming from the cervix to the tube is a long distance.
Okay, long, doc.
It's equivalent to about 43 kilometers walking.
My. Oh.
So you get tired. So,
Okay.
so that's why you need millions.
Okay.
Only the fetus to get to the egg. So that's how it is. Then we'll do what you call intracytoplasmic sperm injection. It doesn't differ. The preparation, everything is just like IVF.
Okay.
The only difference is this time we take the quality sperm, we inject it straight into the egg. Unlike with IVF, we will just put an egg, then we put the sperms around, then the sperms swim and fertilize. So with this time, because the problem is with the sperms, so we choose a good sperm and we push it into the egg, then it fertilizes, then we take the embryo, we put it back into the womb, then she grows. 9 months later, the baby is here.
Wow, this is a very interesting field, okay?
Very.
And I don't know, I'd like to believe it's also quite satisfying. Umo ubonile, you guys did something, you intervened, and 9 months later,
the nice thing is when you've started the process.
Yes.
And interesting enough, last week actually I had a patient that I stimulate. She struggled. She came to me in the private room, struggled. Then we managed to stimulate her.
Okay.
Then we got the egg embryo. Then I did the transfer. So she decided, I want to continue with you. I'm going to stick with you until the end. Last week we delivered a baby.
Wow.
Got the call. Very happy. 9 months later.
Amazing.
So very satisfying. Then we get very satisfied. Said, I've made a difference to this family that have just been struggling.
So there is actually hope out there,
There is.
Doc. There is hope out there.
There is always hope.
Now, Doc, are these luxuries in the private sector?
No, the public sector does offer.
Okay.
We've got a few hospitals, few public hospitals, about 4 of them. Mean around Gauteng, it will be Steve Biko.
Okay.
In Free State, it's Free State, Hospital. Then it will be Stellenbosch, Cape Town.
All right.
KwaZulu-Natal is neither here or there. So the problem with infertility is the equipments are very expensive.
Okay.
That's why, unfortunately, all hospitals can't have it. So it's about 4 hospitals that are certified to run the infertility unit in the public sector.
Okay.
Private sector is everywhere.
Okay. Wow.
Everyone, almost all the provinces got infertility clinic in the private sector, but in public it's about those 4.
Okay. And Doc, how common is infertility?
It is very common among our African culture. We see large numbers, but what has been said in the books is about 15% of the population. 15% is a lot. So it's about 15% of the population, they tend to have they become infertile.
Okay. And Doc, who is at risk of infertility?
Like I've said, both males and females, they're both equally at risk.
Okay.
So remember, infection is one of the commonest causes. Unfortunately, what we call the sexually transmitted infections, those are the ones that cause problems.
Okay.
They damage the tubes in the female, they damage the tubes in the male. So that means they block the transport. They block the transport of sperms, they block the sperm from getting to the egg in the female. So both of them are at risk. Any one of them can have problems in the brain, and you can have problem with the hormones. Okay. So both, they are at risk. Like I said, those that, unfortunately, like I said, sexually transmitted problems, especially in our society, it is a problem. And that infection, most of the time, if you sleep around, things like that, then most of the time, unprotected intercourse, you don't know when you're going to get the infection that later on or might block the tubes.
Sure. Now, Doc, the next question we'd like to know, when do couples usually present with infertility, you know, age-wise? When, like, what are you guys seeing?
Most of the patients we see, they are of advanced age. Remember, when you're still young, in your 20s, still enjoying life. I don't want a baby, now you're pushing life. You don't bother much. If the baby doesn't come, you don't bother much. It's only when you are in your 30s, early 40s, then you see time is going. And women also normally say biological clock. So when the biological clock is ticking, then you realize the baby is not coming here. So now we need to go and check, why am I not conceiving? So most of what you see is the women in the 30s and early 40s. Okay.
Yeah. Though, Doc, wouldn't, you know, we just, you know, thinking, the older you get, shouldn't it be more difficult to conceive?
Yeah, at a certain age, when above the age of 35, 37, going up, then it becomes a bit more difficult because remember, the eggs that you have, these are the eggs that you got when you were 6 weeks in your mother's womb. Those are the eggs that you got back then. So as the time grows, then each month you lose 20 to 30. When you see your periods, you must know 30 gone.
Ow, Doc.
So as the time progresses, then you lose those eggs. When you get to those ages of 35, going up, then they becomes fewer and fewer until you get to menopause. Menopause, it means simply that ovary says, I have nothing to give. Not that I don't have, but the ones that are here and are not suitable for me to give to the world.
Yes. So, Doc, you get born with a certain number of eggs, and from there, like, they just get they get less and less and less until.
Yeah, when you are in your mother's womb, you are 6 weeks. That's the time God will say, I'm giving you this number. Normally, we round it off to about 20 million.
20 million.
You'll be given 20 million.
Okay.
So God says, this is your 20 million. So this is the 20 million you ever get in your lifetime. So as you grow in your mother's womb, then they degenerate until when you are born with about 300,000-400,000. At the time when you delivered and you cry, you must know millions gone, you are left with 300,000-400,000. By the time you start seeing your periods, there are few you are left with about 150,000,
Sure.
which is what most of them you're gonna lose on a monthly basis until you reach menopause.
Oh, okay. And doc, do males have a similar phenomenon?
No, with males, when you are born with nothing.
Okay. All
So
right.
you are born with nothing.
Yeah.
The day when your voice breaks, then you will start having a bass like me. That's the time where now your hormones,
Yes.
they start functioning. The male hormones,
Okay.
they start functioning at adolescent age,
All right.
at puberty. That's when they start functioning. Now you start to produce sperms. When you are born zero, the hormones are sitting there waiting. Hence they say women grow faster than boys.
Okay, wow, we understand, Doc.
Yes.
That was really a mouthful and it was amazing. Babugeli emakhaya, if ningafundi really angazi ukuthi ngingathini, because wow, the doctor is really giving and giving. And njengoba alavele sizomika sure ukuthi sithola konke, because remember, you need to know more about your health so that you can make better choices and better decisions in future mayelana your health. Now, Doc, you mentioned ukuthi STIs are really infections, in fact, you know, are one of the main causes of infertility. So, in terms of preventing that, in terms of preventing STIs, it is the same thing in you know, they must, you know, have one sexual partner and use contraception. Is it just that easy?
Unfortunately, it can be easy.
Okay.
Stick to one partner,
Okay.
one sexual partner.
All right.
Use protection. Do you go see your gynae?
Okay.
Check your gynaes. We're able to do the tests. You can go once a year, go and do the test. Do your pap smears. Do your the test for the STIs. If you know you are a person who's all over, sleeping around, then we just need to check so that if we pick it up earlier, because unfortunately about 70 to 80% of some of these infections, they don't show any symptoms. You don't feel anything. You are just enjoying life, and slowly in the background they are busy damaging your tubes. Later on, now you find your soulmate, you want to conceive, the tubes
And
are
you
damaged.
can't.
You can't. So unfortunately, it is like that. So go see your specialist when you are in the reproductive ages. Check if everything is okay, so that if we pick them up early, then we're able to treat and prevent them.
Okay. Now, Doc, a very interesting question that is coming through is what, you know, can steroids cause infertility? Males using steroids, you know, to be all buff and, you know, amazing.
Yeah, you know, what they use steroids, they'll give you all the muscles. And
Yes.
unfortunately, what happens, they can.
Okay.
When you take steroids, you become all the big men and you're a hunk. But that steroid that you are taking, whether in the form of injection or a patch or anything, it doesn't do the job of what the testosterone, what your natural testosterone does.
Okay.
Your testosterone is able to cross the barrier in the scrotum and go stimulate the sperm to be produced.
Okay.
But unfortunately, the steroids, when injected, they are not able to cross that barrier. So that means they can't stimulate the production of sperms. But because they're in the blood, the brain will read it as I've got enough testosterone. Because it reads it that way, that it's not going to produce testosterone. As a result, few sperms.
Ish. How about it? Hey. Abantu bafuna ukuba ngamahank kunzima ubuhank buza nobunzima bakhona, you know. So Doc Marage, if you use it in moderation, mhlambe like you don't, then could it then be safe?
It is. Remember, it stays for a certain hours, days in the blood. When you stop it, then the level drops.
Okay.
When the level drops, brain comes back against it. Okay, now the levels have dropped. Let me start producing, secreting the the hormones that will stimulate the production in the scrotum. Then your testosterone level comes back, and you start doing the job.
Okay. And now, Doc, one more question on, in fact, two, on infertility. One, here's a female, we are figure they are now infertile, they are struggling to conceive, had an abortion X number of years ago, 10, 20 years ago. Could that be linked somewhere, somehow?
Remember, it depends whether it's done safely or unsafely.
Okay.
Unsafe abortion can lead, unfortunately, because if it's not done safely, it will increase the risk of infections.
Yes.
If the person who's doing does not know what he's doing, he can injure the lining of the womb. If you injure remember we said we need that baby will need a house.
Yes.
In the form of in the uterus.
Yeah.
So if in the womb the house is not ready because it was done by someone who doesn't know what he was doing and he injured the lining of the womb, then that will lead to infertility. Then the other is, like I said, the infection that can also damage the lining of the womb, including the tubes as well. Then that will lead to infertility. So if it's done safely, in a setting where the people who does it is experienced enough to do it, shouldn't be any problem.
It shouldn't be a problem. Okay. And then, Doc, contraception.
Yeah.
Can contraceptives cause infertility?
Remember, the contraceptives, they are there to prevent pregnancy.
Yes.
So how they're meant, when you stop them, you should be fertile. When you're still using them, we call it you are subfertile.
All right.
At that time, because they aim to prevent you from falling pregnant, we expect you from when you stop them to go back to fertile. In general, contraception should not cause infertility.
Okay, so it shouldn't. Oh, all right. But I mean, Doc, I used contraceptives all my youth life, and now I'm married, and now I'm trying to conceive, and I'm struggling to conceive.
No, it shouldn't be contraception.
Okay.
If everything was well, your brain is okay, it's been producing hormones normally, you've been seeing your periods on a regular basis, before using the contraceptions, when you stop them, it might delay the process depending on what you're using. Like the injectables, you can delay up to a year if you've been used for a long time. But once that has been reversed, it shouldn't cause any infertility. Actually, it will help you to preserve dead hormones, even your eggs. Remember, when you use them, the idea is most of the contraceptives, you don't ovulate on a monthly basis. That means you're saving.
Okay.
You're saving the eggs that you're supposed to be losing. So if you're falling pregnant, it shouldn't even cause any problems.
Okay. Wow. Babugeli, I hope you are really, really listening and siyafunda because siyafuna ukuthi nasesifundile singayigcini la siyimikise nakwabanye sifundise sisize nabanye. Ingakho kubalulekile ukuthi wena usathi usafunda nabanye batshele encourage ukuthi holistic healthy living ziyabuya siyafunda more and more and more ngezempilo. Now, Doc, while we are on contraception, mhlawumbe abanye baze bamangele ukuthi hayibo yini contraception preventer. That's that is the late term. Yeah, but to prevent we are chova. Ow.
So the contraception, there are different kinds.
Okay.
You can in the form of a pill that you need to take on a daily basis.
Yeah.
It can be in the form of a patch that you need to plug every week.
Okay.
It can be a form of injections that you either inject every second month or every third month.
Okay.
It can be in the form of implant that has been advertised over in the media that you need to put on, inject it stays for 3 years on your on the arm. It can be in the form of a loop that you insert in the uterus that can stay 5, some can stay up to 10 years. The whole aim is to prevent pregnancy in different forms. Most pills they're in the form of hormones. So these form of hormones, they make you not to ovulate, and they make that house, the womb, not to be suitable.
Okay.
If you fall pregnant, so that the fund is not ready to receive the baby, so that in that way you won't fall pregnant. There are those like in the copper loop those ones, they don't stop you from ovulating.
Okay.
They just make the womb not to be suitable
All right.
for the baby and makes the sperm not be suitable as it passes through. Then it's suitable to go and to be able to fertilize the egg. If it does fertilize, so the house in the uterus is not ready to receive the baby. In that way, you won't fall pregnant. The aim is just to prevent pregnancy in different forms. Of course, they might have different side effects as well.
Okay. And doc, is contraception only for females? Is there any such thing as a male contraceptive?
In the male contraceptive, the form of male contraceptive we have is in the form of we need to block the duct. We need to
Okay.
block the tube that transport the sperm, so we call it vasectomy.
Okay.
So with vasectomy done by the urologist, they just go and tie and block the tubes. In that way, the sperms are there, but they're not able to pass.
To pass. Okay. And can this be reversed, or as in washa?
It can.
Okay.
It's easy to do it,
Okay.
but to reverse, it needs a special skill.
Okay.
So to reverse, it needs a special skill, but it is reversible.
Okay.
So you just, where it has been tied, so you can tie it back, and then the tubes are back again, then the transport goes. But you must be sure, if you really want to do it, then you do it. It is quick and easy. It can be even done in the rooms.
Oh, interesting.
It can be done in the rooms.
Okay. And doc, who should be taking contraceptives? And from what age is it safe to start taking contraceptives?
Contraceptives, any woman of reproductive age, meaning
Okay.
any woman, once you start seeing your periods, your cycles, that's the time any woman at that time can take contraceptives.
Okay.
Because previously, reproductive age, we used to say maybe from 16, but any woman that is sexually active and sees their periods, that one must be on, and they don't want a baby, then they take contraceptives, and in order to prevent pregnancy. So anyone who wants to prevent pregnancy, who doesn't want a baby at that time, can use it. Must be sexually active.
Okay. And doc, let's say Nangumuntu, they didn't want to have the child, and oh man, they went on contraceptives and they just found out. Is there anything that can be done for them, like safely so?
If they want contraception.
They weren't on contraception and they fell pregnant.
Okay.
Is there any, kuhlala kukhulunywa nge-morning after pill? Iyini?
It is that it's another form of contraception.
Okay.
What we do, what they do, they can be in the form of a pill or a loop.
All right.
So with the pill, you need to take it within 72 hours of the sexual encounter.
Okay.
You take it within 72 hours, and depending on the different companies and forms, others you take once, others you take twice within 12 hours apart. With the loop, normally we use the copper. With the copper, you use it. You can take it within 5 days.
Okay.
So the idea with the tube, with the pills, is to stop the woman from ovulating. That's why we say take it within 2 hours, is to make the woman from stop ovulating,
Okay.
because already the sperm has passed. So stop from ovulating and make the womb unsuitable to carry the
Okay.
baby. With the loop, it's just simple to make it. That's why we say within 5 days. So in case something happened, as it travels back, when it gets to the womb is not ready to receive, then it just passes.
Oh, all right. And that is how it is actually effective.
That exactly.
Okay, now doc, omunye mhlawumbe uyazibuza lapha ekhaya ukuthi, can withdrawal be used as a means of contraception?
It is very risky.
Okay.
The-
It's very risky.
It is very risky.
Okay.
Remember, sometimes before you ejaculate, before
Yes.
you feel the ejaculate,
All right.
some of the seminal fluid, semen or sperm, might have passed before you think of withdrawing.
Oh,
So it is something that will not encourage.
okay.
So because the failure rate is quite high, about 20% of them will fail, or even higher. So it is a risky way of using it as a contraceptive.
Okay, and next, doc, the rhythm method, abanye bayibiza nga the calendar method,
Yeah.
can that be used?
The calendar method, there are certain prerequisites, the things that you must do to qualify if you want to use that method.
Okay,
First of all, you must be able to track your cycle.
all right.
If you're able to track your cycle, that means your cycle must be regular. Must
Okay,
be on a regular basis. You know that if I see my period today and I count, my next period is going to be this day. So in that way, then you can check that within the, if your for example, your cycle is a 28-day cycle, then you know that within the first 9 days, I'm still safe of the cycle. Because sperm can stay sometimes even up to 5 days.
Really,
In the tube,
doc?
waiting.
Wow.
Men are always patient. Men are always
Men are
patient.
always OMG, ndiyabuza udokotela uthi, hey, men are always patient.
So they wait.
Okay, now, doc, you know, as we are wrapping this up, just a few more questions. Are there any other apart from, you know, contraceptives being used to prevent pregnancy, can they be used, like, are there any other benefits?
They are.
Okay.
Especially with the pill.
Okay.
The combined pills, the pills that you normally get used to prevent, they've got other benefits.
Okay.
First, there are other conditions. If there are women that suffer from endometriosis, it prevents you from getting endometriosis.
Okay.
It can help prevent from endometriosis. It can prevent you from getting cancer, like cancers of the ovaries, cancers of the womb, endometrium lining of the womb. It can prevent you from getting the breast cancer. So it does have benefits. It's the same as what we call the loop, the hormone-containing loop that also can prevent from cancers and can prevent you from, if you've got your heavy periods, it will reduce the flow.
Okay.
So even the pills can also reduce the flow. It reduces the monthly menstrual cramps. So they've got, they do have benefits apart from the contraceptive part of it.
Okay, and then, doc, other people, but see, it can actually also help with skin. Is that true?
Yes, not all of them.
Okay.
There are different
Which ones? Ladies?
There are those that contains normally what you cause the skin there or acne is because of the dominance of the male hormones.
Oh.
So yes. The dominance of the male hormones can prevent you from getting your acne and stuff. So what we do, we use the hormones that contains anti-male hormones, like anti-androgens.
Okay.
Those ones, they'll help. Those are the ones that will help you clean up your skin because they suppress the male hormones in your body, and then you don't develop the problems like your pills. If I were to mention, I don't know if I'm allowed to mention brands. Your Yasmin, your Yes, your Minervas, your Jeanettes, they contain what you call anti-androgenic activities.
Okay.
Those are they help with the skin.
Wow.
Yeah.
Wow, that was a mouthful. And sifundile. Siyabonga kakhulu kuye udokotela wethu. You know, unfortunately, sesifike kuleso sikhathi la kuzomela ukuthi sivalelise. But before sivalelise, we're just going to ask udokotela, please, your last words that you would like to say to the viewers out there.
What I can say to the viewers is, when it comes to the fertility side, the main thing is just to stay safe. Don't blame yourself. There's always hope. Don't lose hope. So this is what I always say, you don't lose hope. If that baby is not coming, you've been trying, it's not your fault. There is help out there. All you just need to go and look for it. Then there's always hope. Anyone can get the baby. Anyone can fall pregnant. Anyone is still, whatever that happens, the help is always out there. So don't lose hope and keep on trying.
Wow, that was very, very encouraging. Uthi dokotela masingapheli amandla, ungapheli amandla. Go out there, usizo lukhona. It's just for you ukuthi ulthole endaweni right, endaweni efanele. And from our side, Doctor, we thank you so much for your time. Thank you for coming through.
Pleasure.
Wow, siyabonga kakhulu babukeli emakhaya kanti ke sekuyileso sikhathi lapho kuzomela ukuthi sivalelisane kanti singakahambi siyacela ukuthi singakhohlwa while we are still going through a pandemic. Please, it is important that you sanitize. Don't forget to wear your mask konke lapho oya khona, and please keep a safe social distance. Siyabonga kakhulu, masihlanganini futhi esontweni elilandelayo lapho sizofunda more about health. And from my side, your host Uzinhle Mazibuko, siyabonga kakhulu, and we'll see you again next week, same time.